right. Hello, friends, and welcome to the January 18th MLK Day edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about public policy issues here in the great state of Texas and have a conversation about how you can engage in the process. My name is Scott Atnip, your host and Texas Impact's Outreach Director, and today's episode is being brought to you by Methodist Healthcare Ministries of South Texas. Quick programming note at the start. Next week, Weekly Witness will not be broadcasting live because Texas Impact is going to be hosting the United Methodist Women's Legislative event Saturday through Tuesday. They would love for you to join that event. You can register at texasimpact.org. We're excited that there are a record number of people participating this year in the online format, and we hope that you will join them. So we'll be back with you live Monday, February 1st. Remember, for those of you listening on podcast, you are welcome to join the conversation live by going to texasimpact.org and registering, and we'll send you a link to bring you into the conversation so you can ask questions of the Texas Impact team and our panelists. And we are excited about today's episode, the first episode of the 87th Texas Legislature. We're going to be featuring former five-term state representative Sarah Davis, who's going to be talking about Medicaid expansion. We'll have Josh Houston with our legislative update of the week. But first, to help us put a theological frame on the conversation, I am excited to welcome my friend and pastor of Boynton Chapel United Methodist Church in Houston and co-chair of the Texas Annual Conference Commission on Religion and Race, Reverend Linda Davis, for this week's Weekly Word. Reverend Davis, thanks for being with us. Look forward to your word for the week.
Thank you for having me. Today, as we remember, celebrate, and reflect on the life and legacy of the Reverend Dr. Martin Luther King Jr., the drum major for justice, peace, and righteousness, let us listen to and read his speeches and essays to help give us guidance on how we move forward from and begin to prepare for a post-global health pandemic. Dr. King's vision was for a better and more inclusive America. You know, we remember his famous quotes, "I have a dream. Injustice anywhere is a threat to justice everywhere. The ultimate measure of a man is not where he stands in moments of convenience and comfort, but where he stands at times of challenges and controversy." But I challenge us today with one of Dr. King's quotes, not so often recited. Life's most persistent and urgent question is, what are you doing for others? I posit this same question more specifically to healthcare and health reform. What are you doing so that all have access to quality healthcare? In 1966, Dr. King, in a speech in Chicago to the medical community for human rights, states, of all the forms of inequality, injustice to healthcare is the most shocking and inhumane. It is now more than 50 years later, and health disparities research still affirms the pervasive role of racism in health status and in the access of health care. Dr. King saw healthcare as a civil rights matter as much as voting or equality in education. When people do not receive or cannot access quality healthcare, it is an injustice. Access to health care creates healthy individuals and healthy communities. People of color are more prone to chronic disease, mental illness, or other sicknesses. So I ask the question again, what are you doing for others as it relates to healthcare and healthcare reform for those suffering from poverty? More importantly, what is the faith community doing so that all have access to quality healthcare? Yes, we pray when someone is sick. Yes, we prepare a meal. Yes, we may even drive one to the hospital. But what are we doing to ensure there is health care available for all, regardless of one's social economic status? There is something that we can do. We can't care what and how policies are made on our behalf. We can get involved, write a senator, call a representative, get more information, study the issue. We can care about and be part of how policy is developed from healthcare reform on the state and local levels. Let us posit Dr. King's substantive blueprint to finally build a true beloved community, one that acknowledges that all people have access to affordable health care. Now more than ever, Dr. King's words ring true that silence is not an option. We must be a part of creating a world that's available for all to have health care. Thank you.
Thank you, Reverend Davis. I love this new segment because now I feel like I get a sermon on Sunday and a sermon on Monday. So really appreciate you spending the time today and for those words, especially on this this holiday celebrating Dr. King. So thanks for your time today.
Thank you for having me.
All right. I promised this wasn't a theme today, but our next speaker also has the last name Davis and is also from Houston. Next, we're going to welcome to the conversation former State Representative Sarah Davis, who served 5 terms in the Texas House of Representatives and chaired the Article 2 subcommittee of the House Appropriations Committee, which is important for our conversation today. She currently practices law in Houston and is also the newest member of the board of directors of the Texas Impact Foundation, Texas Impact sister organization. So, Madam Chair, thank you so much for the time today. Thanks for your work and really looking forward to the conversation. Thanks for being with us.
Well, thank you so much for having me, especially on this wonderful holiday, and have the opportunity to talk about something that I love to talk about, which is healthcare. So I'm really honored to be here, and I'm really excited too about the opportunity to be on the board. I'm really looking forward to working with everyone at Texas Impact and seeing what we can accomplish together.
We'll look forward to that relationship over the weeks and months to come. And I feel like Reverend Davis teed you up pretty well for the conversation we're about to have. So most Weekly Witness listeners are kind of familiar with the idea of Medicaid expansion. We've talked about it for years and years, but just to be on the safe side, can you give us a thumbnail explanation of what exactly that means?
Sure. I think we just need to start too with making sure everybody understands what Medicaid is, because a lot of people get confused. What is Medicaid? What is Medicare? So Medicaid is a state and federal program that provides health insurance to our needy Texans. And it's a joint program in the sense that it's administered by the state, but it's jointly funded. So the state pays a portion of the program, and the federal government sends some money. And that percentage is called the FMAP, the Federal Medical Assistance Percentage, FMAP. That'll be an important term to remember. So right now, the FMAP is about 62% federal dollars coming into Texas, although we did get a bump in our FMAP because of the pandemic. So we get a significant amount of money for our Medicaid population, but we have a very narrow definition of what we consider needy and who is eligible for Medicaid in this state, which is something that I didn't know, when I was first elected. And so our definition of who is eligible for Medicaid is not just being poor, but you also can be one of 5 categories: pregnant, responsible for a child under the age of 18, blind, disabled, or caring for a family member that has a disability, or 65 and older. So it's not enough to just be poor in the state of Texas. That is not enough to qualify for Medicaid. So as a result, we have this population of people that don't qualify. And that is what we call the expansion population. And the numbers that I think are pretty accepted by the medical community and other advocates is that population is around 1 million people. But we also know that that population has grown because of COVID, because we've seen a lot of people losing their jobs and losing their employer-based insurance. So we believe that that number is actually higher than 1 million. But for the purposes of a general discussion, I think most people look at the expansion population as being right around 1 million Texans and growing.
All right. So this is an issue we've been talking about for years, but former Texas House Speaker Strauss said in October 2020 that expanding Medicaid is a smart business move. So in addition to those 1 million Texans, it's also good for business in a state that prides itself on its business climate. So do you agree? And if so, why?
I absolutely agree with Speaker Strauss. In fact, I think the only thing I ever disagreed with him on was his retirement. He is, such a statesman, and it was just such a privilege to get to serve as his chairman in various capacities. But he's absolutely right. I think there was just a Perryman, who is a very well-known and accomplished economist here in Texas, released a very thorough report. And I'm not going to bog you down with all the details, but ultimately the conclusion was that the economic benefits that could be gained during the 2022 through the 2023 biennium, because remember, we write 2-year budgets in the state, would include over $45.3 billion in gross product and 670,000 job years of employment. So that's a huge economic impact. I also had discussions with economists, healthcare economists, about the impact that Medicaid expansion could have on our property taxes. Because if, like, I live in Houston, and Reverend Davis from Houston, a lot of us that live in large cities probably have hospital districts that are charged with providing care to the poor. And that is a taxing jurisdiction. That is a line item on your property tax bill. And so in the long run, I think you can make the argument that if we were to move this population that is receiving their health care through the hospital districts that are uninsured into an insured situation like Medicaid, that you would actually see some relief, some legitimate relief on your property taxes. And I also think, when we're looking at a really tough budget cycle, I know the comptroller said we're looking at a $1 billion shortfall. I'm not entirely sure if that accounts for the couple $1 billion we shortchange Medicaid at the end in every budget. But it is not going to be an easy budget to write next session. And there are ways that we can actually, pay for Medicaid by transitioning folks that are getting healthcare services that are being paid for strictly with state dollars into the Medicaid program. And how that saves the state money is going back to that term FMAP, because the Medicaid expansion population would enjoy a much larger FMAP. So if we were to have a Medicaid expansion population, that's actually a 90-10 match. So that means that the federal government would pay for 90% or send down 90% of the costs, where the state would have to come up with the 10%. And there are plenty of there are plenty of sources that you can come up with to find the money that would pay for itself, purely because we wouldn't need those state-run programs anymore. Those populations would transition into Medicaid. So there is definitely ways to pay for it, and there is definitely, I don't think, a more important economic time really to embrace Medicaid expansion. And at the end of the day, we're only one of 12 states that haven't done it. So we're all paying for Medicaid expansion. We're just paying for it for everyone else except for Texans. Right. And that doesn't make good sense. Why should our Texas tax dollars, not stay in Texas? So no, I think Joe is 100% right. And I think that it's just a very, it just makes economic sense, and it just makes, health sense. We've got people that are participating in very targeted state healthcare programs, maybe for substance abuse, maybe it's Healthy Texas Women's, but they're not getting a holistic approach to healthcare. And so you don't see good outcomes. And you, especially as Reverend Davis mentioned, we have horrible outcomes in our minority populations, as evidenced of what we see going on with COVID and how it's ravaging our communities of color.
So let me ask, because you mentioned Houston, and certainly you represented a lot of healthcare providers in the Houston area. I live in East Texas, and folks out here where I live are worried about, hospitals surviving. We've seen several rural hospitals close. Medicaid expansion would certainly help in the rural parts of the state too, right?
There's no doubt about that. During the budgeting process, once we get to conference committee, we're always having to do supplemental hospital payments to keep hospitals open and to make sure we have rural and safety net hospitals. So absolutely, Medicaid would be crucial to rural healthcare. And you're right. Sometimes it's easy for me, to forget that, because I look in the medical center right now. It's literally in my front yard. But that is not the case, of course, for many, many Texans.
Right. So Texas Impact has supported Medicaid expansion since it became a possibility through the Affordable Care Act, and we're cautiously heartened to see growing support for it. So as someone with a great depth of knowledge about our state's healthcare systems and budget, what do you see as the paths and pressure points and barriers to Medicaid expansion in Texas?
I was encouraged, during campaign, because I was actually hearing other Republicans advocating, or at least, being willing to talk about Medicaid expansion. I have not heard that from anyone in the other chamber from Republicans. And so that is of some concern to me. A lot of the messaging that I was focused on with regards to Medicaid expansion dealt with the expiration of the 1115 waiver and the loss of the billions of dollars that come with that waiver. I don't know if everyone knows, Texas really got that waiver in. It was announced on Friday that we have a 10-year 1115 waiver, which I've not seen. So Texas is able to get that waiver done right before the end of the Trump administration. And so that's great, but it also kind of lessens some of the momentum that I was feeling about Medicaid expansion. But let me just make it clear, the 1115 waiver was never meant to be a permanent fix. It was really supposed to be kind of like a bridge, because we were assuming, or the government was assuming, that the states would be expanding Medicaid. And so this was sort of money that would be available to the hospitals and providers until all of the newly insured were able to get enrolled. And so we've basically just been piecing our health care together with these waivers. And we've gotten extensions. This is the first one I've seen for 10 years, which is pretty significant. But at the end of the day, the best case scenario with this waiver is just the status quo. It's not Medicaid expansion. In fact, the DSRIP dollars that are billions of dollars, those are lost. Although I do understand that there's going to be some additional funds for behavioral health and mental health outside of the UC pool, but under the waiver. But again, at the best case scenario, it's really just status quo. We needed the waiver, but that doesn't solve our uninsured, population whatsoever.
So I will get fussed at in my email every time I don't ask what people can do, right? Our people listen to this podcast and want to know what they can do. So our listeners have been working on Medicaid expansion for years to no avail. So what advice can you give them about concrete steps that they can take during this legislative session to advance the cause? So
the first thing everyone needs to know is the first 60 days under a normal legislative session is dead time. We're not allowed constitutionally to take any votes. Committees aren't formed, or they are being formed, but they're not formed yet. Now we're in a different environment now with the pandemic. I think the House is out for a couple weeks, but this first 60 days is really when you need to be on the phone or on Zoom and contacting people, contacting your legislators. And don't forget about the Senate, because I can't tell you how many conversations I have with constituents over the last 10 years wanting, to make change, and I'm willing to help, but then have totally ignored the other chamber. And so we've got to, I always say, don't forget about the Senate. In the last session, we made some interesting headway. We actually passed legislation that allowed women to stay enrolled in Medicaid for a full year after she gives birth, as opposed to 60 days. Now, that did not go through in the Senate. But I thought that that was a great indication that we had some momentum, that there is growing understanding that we need to do more as a state. And I see a lot of focus on maternal mortality and morbidity. So I would say always advocate for Medicaid expansion. And I think you can familiarize yourself with some documents like the Episcopal Health Foundation has a great white paper about the economic impacts and how we can pay for it. I would read that and share that, and then share that with your legislators. Like I said, these first 60 days, they've got a lot of time on their hands. But even if you can't get to an actual elected, don't forget about the staff. The staff run the building. I mean, that's their full-time job. We are there for 140 days, and then, we go home. And our staff, or the staff, is there making sure that things run. And I can't tell you how important developing relationships with the staff is, because they a lot of times help drive the policy decisions that are being made by the particular elected official. I mean, I may have an idea like, I want to increase funding for substance abuse in this state, but I will have a staff do research and say, hey, there's only 3 places that take pregnant women and women with children, and that's the number one reason why children are removed is substance abuse. Oh, so then let's focus resources on there. That wasn't my particular idea. That was staff working with advocates. So I say, don't discount the staff. In fact, sometimes they're way more important than the elected officials. But I also appreciate when someone says, we're going to have a meeting or a Zoom, and I receive a 1-page, prep of what we're going to talk about, so that I can get my mind ready to engage in the conversation. And so you want to think about no more than 1 page, but I always think providing some initial information is very helpful, and always follow up. Because I usually would say I have to hear something and read something 3 times before it sticks. And so, you want to be persistent. But also what I have found to be effective is if you're going to approach a member and you're going to ask them to support something like Medicaid expansion or allowing women to stay on the rolls of Medicaid for 12 months, maybe take a look at some of their priorities and see if there are ways that you can offer to help them with their priorities. Can you write a letter, or can you get a group of people, to show support? So try and find a way to make yourself, useful to the office, so that you're not just there with an ask, but you're also there with some help. I would think that's a good strategy.
And we talk about that a lot, right? The relationship is actually important. You can't just make a telephone call and ask somebody to do something. That has to be a 2-way street. So thanks for saying that. You'll be echoing Josh will be echoing what you say very soon. Are there any particular messages that you would be talking to members about now in regards to Medicaid expansion?
I think given the political makeup of the chambers, I think the economic impacts of Medicaid expansion cannot be ignored. And I think you need to use your language carefully. We have become so polarized. A lot of members hear Medicaid expansion, they hear Obamacare or Affordable Care Act, and they shut down and they stop listening. But we have to remind people that was a decade ago. We're talking about the uninsured population in the state of Texas. So that's how I would phrase it when you're talking to members, is the uninsured. So I would just say, use your language carefully, because you don't want to get in a situation where you just have people that just are zoned out. But also keep in mind, healthcare is complex and Medicaid is complex. And so you can't assume that everybody, all 150 members in the House and the 31 senators are all experts on these things. So.
All right. Well, any other pieces of advice you'd give us before we let you go for the day?
I would just say, send the email, make the phone call, ask for a Zoom, ask for a call. I mean, a good representative is not going to say no to a constituent this early. But I want to stress, you have about 60 days before things get so hectic in the chambers that those types of meetings become much more difficult to accomplish.
Well, thank you so much for the time today. Really appreciate the work that you have done in the past and continue to do on behalf of Texas families. And really look forward to working with you over the coming weeks and months as you've joined the board. So thanks again for all that you do.
Thank you.
All right. So certainly thankful for that conversation. And we will now welcome to the panel, Josh Houston. Josh, thanks for joining us. First weekly witness of the legislative session. I'm not going to ask you how you're feeling because last week that was not received well.
I'm actually feeling good because it's 1 week down. Only 134 more days to go. We've survived the first 6, so it's off to a good start.
All right, y'all. I told you we'd get some feelings out of Josh before the session ended. So, Josh, it was certainly a different week last week than a normal first week. We had that in addition to all the COVID-19 stuff and other things going on in the world, the House of Representatives elected a new speaker. Both chambers approved their rules. What did we learn from week 1?
Yeah, I think if I were to top line it, that they're being very cautious so far, and that's good, and we want to applaud that. They will not be back until January 26th. Well, let's go ahead and recap. As we just heard, the first 60 days always starts slow, thankfully. So there's not a whole lot to recap today, but they picked a speaker, they set rules, and then they adjourned until January 26th. So let's start over in the House with the speaker. As expected, the House on Tuesday elected Speaker Phelan. That was widely expected. It would have been crazy and weird and newsworthy if that did not happen. Let's talk a little bit about the workflow of the House. They have to appoint committees. One of the common things that they do is they pass out committee cards where each member of the legislature picks what committees they'd like to serve on, and that's decided both by the seniority or longevity a member has served. And then there are just speaker selections, and then there's rules that govern how that comes to pass. But those are due back when they return on the 26th. So no committees at all until the 26th for sure. And it's going to be probably much longer than that. Whenever you have a change in speaker, you often have a big reshuffling of the kind of leadership structures that the House creates, including who gets to be chair and chair of what, and then how you construct those committees. So I know to talk about why does this affect our work? Well, it's a giant task. And I know people often I sometimes get an email or a phone call about some bill that's been filed. And I always like, is that going to pass, Josh? And the answer is, I really don't know. The first thing to do is to see what the committees look like, because how those are designed and structured and who sits on them really determines the viability of all the legislation that comes through. So we'll see how the committees are constructed. And of course, the longer that takes, the less they're going to be able to do, which in a COVID session is probably a good thing to aspire to less. And we'll talk a little bit about why here at the end. Let's talk about the rules real quick. For the rules, let's jump over to the Senate for a bit. The Senate really bifurcated its rules discussion into the two big items, which is what is the threshold going to be to bring a bill to the Senate floor? And that was a great big discussion. And then there was kind of everything else. So as expected, the Senate changed the rule again. If those of you who have been longtime watchers of the legislature, it used to be that it took 2/3 of the Senate chamber to allow a bill to come to the House floor. And then it became 3/5 when Lieutenant Governor Patrick was elected in 2014. And then in 2015, they changed that rule. And then in this past session, Democrats elected that 13th vote they needed to block legislation. So the Senate, predictably, and as expected, changed that rule to a 5/9 rule, which of course requires 18 Republicans or 14 senators to block a piece of legislation coming to the floor. So the punchline is the Senate is going to operate a lot like it did for the last several 2-3 sessions. And I think most everybody expected that. So the magic numbers, if you're a vote counter like I am, is you need 18 to move a bill and you need 14 to stop a bill. And so that will be the new magic numbers. As for committee assignments, which actually affects our life, I think just as much, probably just as much. I don't want to say more necessarily, but the way that they're going to be doing the committee process, because so much of the policy that they do is leans heavily on the work that committees do. The Senate passed what they kind of said, or quote, temporary rules. And what they mean by that is these are going to be the rules that we follow for the first 60 days. Because of course, the heavy committee season doesn't get started in that first 60-day time period. And they kind of expressly said in their debate on the Senate floor that they didn't use the term punting, but they are essentially punting on the decisions about committees and how they're going to work until closer to time for those committees to actually meet. So that's not a bad approach to take, because why should we decide a thing now when we don't know what the world's going to look like in 60 days? We don't know if there's going to be how available a vaccine will be. We don't know how much people have contracted the virus and are therefore immune. How close are we to herd immunity? What are the hospitalization levels? They're just going to wait 60 days and see on all that. The House, when they did their rules, let's jump back over to the House. The House has a little less flexibility than the Senate just because of the way it's structured. There's 150 of them. So they're not quite as flexible, but I think what they did with the rules should be seen in this light as well. That they're kind of taking a small c, conservative, cautious, wait and see approach. The House has always allowed virtual testimony. It's just extremely rare. It has to be invited. You have to be invited to come testify virtually. It is not for the public. That was one of the big things that people discussed. The open question is will it be less rare to do invited testimony? I think we're going to have to wait and see, and it's going to be up to the chairs, and there's going to have to be a little bit of pressure, and that we'll have to work that out as we go. And again, the unknowns are the vaccine and how far are we to herd immunity when it comes closer to time for those House committees to meet. So they're just taking a very cautious approach until they just have to absolutely make decisions at the very last minute. And for that, we would applaud that. It's too early to say let's punt on having a legislative session. It's too early to say, and there's just too many people in the hospital to responsibly say, yeah, let's go on as everything's fine. They haven't taken that approach either. And that is all extremely important because there's some sad news to report, which is on Friday. There was an announcement made that one of the House members tested positive for COVID. This House member was on the floor Tuesday, Wednesday, and Thursday, and on Friday tested positive, meaning this member was most likely probably infectious. It's just Monday. There's been no subsequent news of people having caught it from this legislator. But we would just pray for this legislator, pray for the other members of the House, pray that they continue to make wise decisions that protect both themselves and their staffs and all the other employees, the cafeteria people, et cetera, that work in the building. Here we are. It's going to be we'll just have to just pray that it's not going to be super, that nobody is hurt.
Absolutely.
It's kind of a tough question.
So So we've talked, both Chair Davis and you have talked about the importance of relationship building over the course of these first 60 days. And, we talk about that all the time, right? That building relationships with both the members and the staff is important. Is there anything that you'll be watching over the course of the next week or two, or is it really just meet your legislator time?
Yeah, I would say it's really just meet your legislator time. I know my next work week with them not convening is focused on our membership and getting our membership to do things. And those things right now are meet with your legislator. I'll give you a little preview of what I think is going to be things we really, really need you for. Of course, there's going to be a big budget thing. Even everybody was kind of like, "Whoo! It's just $1 billion." I mean, the other side of that coin is if you were expecting horrible news, it was good news. But being $1 billion with a B short is not good news. It's going to be extremely hard to write that budget. There are pressures on the budget with school finance. There are pressures on the budget with a number of people. I mean, the people who are most adversely affected by COVID are people who disproportionately do not have insurance. That's obviously not across the board. I don't want to overstate that, but I do want to say that there's a disproportionality there that creates a budget problem. And of course, with people losing jobs, then that means all the more pressure on the budget and what's called uncompensated care for the hospitals. The hospitals are getting a pinch, not just in their workflow, which they are, God pray for our people that are doing healthcare right now, but financially as well. So I think those are the things that they're going to have to deal with. The things that I think where if I was predicting on this date, and I guess I am, that we're going to be talking a lot about where the public, you can really be effective and we're going to really need you. Obviously, Medicaid expansion, we just talked about that. It's going to be one of the big ones. Voting rights is going to be up there. I think you are going to see, frankly, an all-out assault on the right to vote, where we already are a state that makes it really challenging, and things to make it even more challenging to vote. I'm really worried about that. I really think you're going to be calling your legislator pressuring on some of those bills. And then the third thing, which is actually two things, religious freedom and non-discrimination, and making sure that we are super clear that those two things are not competitors. Both are what we would call civil rights, and that there is a path forward where those two things don't have to be in a zero-sum, death match, because they're not really, and I say this on any given issue, but this one's a good example, really be leery of people who take two things you value and tell you that you have to value this one and pit it against the other one, where they're pitting two values that you hold against each other. That's a trap. It's a false dichotomy. So really paying attention to religious freedom and the plurality that is the United States of America and Texas in 2021, and non-discrimination, not just on LGBT issues, but on George Floyd type legislation as well, police reform as well. And I think we all learned that we have a domestic terrorism problem we've been ignoring for way too long as well. And I think these are going to be areas that are quite contentious, that absolutely require you, the public, to interact with your legislator.
So we would typically end our weekly witness segment talking about our action alert for the week. And this week, we're still focusing on building those relationships with the legislative office and figuring out how they're going to operate and who the best person to talk to in the office would be. Is there anything else you want to add on that?
No. I mean, we have our United Methodist Women's Legislative event coming up. That's more exclusively for Methodist women, although they're a very inclusive bunch. But then we also will have Texas Interfaith Advocacy Days, which is for more of the other denominations and groups and constituents of our membership. That is the place to plug in, and a place where we're going to dive a lot deeper, and I would promote those events, upcoming events.
Absolutely.
Of course.
I'll promote a couple of other opportunities at the end. We have a couple of questions in the chat. First, is there an audit of expenditures from the last budget cycle that you or anyone else has seen?
Well, I mean, there's a state auditor, the state auditor's office. I'm struggling a little bit with what we mean by audit. The budget work has already begun. It began over the summer, where then they go through the legislative appropriations request process, where each agency puts forth what they think they're going to need in the next budget cycle. So the budget cycle, and then that's overseen by a thing called the Legislative Budget Board. And the Legislative Budget Board often dives in over the interim deep into these policy areas. They also do a process called the strategic review, where they will pick certain agencies to it's like an audit, I guess you could call it that, where they're looking at the budgets of each agency in even more detail than they already do through the normal legislative appropriations request. And then we have the sunset process, which looks more at policy, but also gets into some budgetary issues a little bit, inevitably. So yeah, all that work happens in the interim and has been continuing in the interim, even if remotely, and even if under the same struggles that everyone else has had.
And you want to say a word about if and how Texas Impact will be engaged in the debate on preemption?
Oh yeah, absolutely. That one probably should have been number 4 more explicitly, because like non-discrimination ordinances, for instance, are city by city, even though we don't have a statewide protections on some of those items. So yeah, no. Preemption is a kind of a legally word. What we basically mean is local democracy. I'll tell you that, I mean, it was big in the, it goes from everything from payday lending regulations, non-discrimination on LGBT issues, bags and tree ordinances. But then the one I think that probably made the most attention, got the most attention recently anyway, is the campaign talking point about the Austin Police Department and the Austin City Council's decision to quote unquote defund the police. And there's a big effort for the state to come in and take over the Austin Police Department. And, you know, I'll say the thing that all these things have in common is that the state is coming in paternalistically and taking away your right as a voter to decide these issues for yourself as a voter through the normal democratic processes, small d democratic processes that we have in place. They basically are, the thing that all these things have in common is, local voter, we don't trust you. So we're going to make this decision for you. And when we're having a crisis of democracy, it's a real problem. And we would be for more democracy, not less democracy.
Josh Houston, supporting democracy since a long time ago. All right. I'm not seeing any other questions in the chat, so I do want to highlight a couple of opportunities over the course of the next few weeks. First, we do have the United Methodist Women's Legislative event beginning this Saturday, January 23rd, and going through Tuesday, the 26th. That is an online event this year, which opens it up to many more people who might not be able to typically make a trip to Austin for a 3-day event. So we hope that you'll consider registering for that soon. It'll include the same great speakers, theological reflections, and opportunities for legislative visits in different forms than previous years. Similarly, as Josh mentioned, the Texas Interfaith Advocacy Days will be March 7th through 9th. That registration will be online soon. But more, and we've talked about this the last couple of weeks, y'all, it's going to be really important for each and every person to engage their legislative offices. We can't rely on people going to the Capitol and making visits and doing the typical lobbying work or advocacy work that we do in a typical session. So we really hope that you'll engage to the full extent of your ability. Texas Impact has 2 opportunities for that. The rapid response team, where you'll receive an email or a text message when we need you to make a call in a hurry. and the legislative engagement groups, which will pair you up with other advocates in your district to build relationships with those legislative offices. You can register for both of those on the website at texasimpact.org. If you can't find it, shoot me an email at scott@texasimpact.org and we will get you connected. But it's going to be vitally important that everybody play their part this legislative session. Josh, anything you want to add before we close out today?
No, thank you for having me.
All right. Thank you, Josh. And thank you all for tuning in. Please remember that next week we will not be broadcasting live because we'll be in the middle of the 4-day United Methodist Women's Legislative event. But keep an eye on the podcast feed for content from that event that will benefit the broader community. We'll certainly miss seeing you in person, but we are thankful for all of the opportunities we're going to have over the course of the next few weeks to get together online. And remember, if you appreciate the work of Texas Impact and the Weekly Witness community, and I assume if you are 45 minutes into this program and still listening, that would be you, please make sure that you and your congregation are members of Texas Impact. Our work is supported by members like you, so you can go to texasimpact.org/join to become a member today. Y'all, we have been talking about it for 18 months, and the legislature is now here. They're in session and they're getting ready to start the work that is so important to you and to your communities. And so now is the time to be focused, active, and engaged. So let's get to work. All right, thanks, friends. For those who are in the legislative engagement groups, we will be switching over to the other Zoom line now to continue the conversation. If you're sad that you're not a part of that conversation, make sure to go sign up for a legislative engagement group soon. Thanks, friends.